The content of this podcast is provided for general informational purposes only and is not intended as, nor should it be considered a substitute for professional medical advice.
Sweaty and pissed, menopause makes me sweaty and pissed.
Hello, sweaty and pissed listeners. This is Karen Nickell, family nurse practitioner in for sweaty and pissed, menopause, and more. I have some great listener questions to share today, and hopefully I will provide some useful answers. You know, this show is always evolving, and our podcast name is evolving also. We will be known as Itchy and Bitchy, and I suspect that for those who are listening to this podcast, you will get that. And now on to our listener questions. Penny asks, is it possible for a low dose of estradiol, 0.5 milligrams, to cause sore breasts? I have had a total hysterectomy and current mammogram that was fine, but I have breast soreness off and on. Penny is also wondering if this is something that happens to others. And Penny, I'm sure it does. And that's why I think answering your question so that the other listeners can hear it would be very helpful. So yes, when you're taking estrogen, especially estradiol, which is one of our three forms of estrogen in our body, we have estriol, estradiol, and estrone. And estradiol is our most stimulatory form of estrogen. So it can and will stimulate breast tissue. So sometimes when the estradiol levels are too high, they will cause that elevation will cause breast tenderness. So sometimes that happens because we're just not clearing and metabolizing estrogen appropriately. So one thing that can really help if you're remaining on estradiol tabs is to add diindolmethyl, DIM for short, D-I-M, D as in dog, M as in Mary, 100 milligrams twice a day. If you ever have breast tenderness, it will help clear some extra estrogen from your body, resolve the breast tenderness. And once the breast tenderness is resolved, you can stop the supplement. I do have some patients who take it all the time just to help with estrogen clearance, which is fine as long as you're not getting low estrogen symptoms while you're on the DIM. For someone who's taking it every day, you might want to just do 100 milligrams once a day and stop it if you start having low estrogen symptoms like hot flashes, night sweats, anxiety, poor sleep, joint pain. It goes on. So many symptoms. Anyway, so yes, it can cause breast tenderness, the estradiol. And the other thing I do for women is, even if you've had a hysterectomy, I put women on progesterone because it helps balance the estrogen. And progesterone slows and matures the cell in the breast. So it can help offset some of those stimulatory effects of estrogen. It's a great question, Penny, and I'm sure that others will benefit from that answer. Okay, our next question is from Harriet, and she is a 60-year-old woman and has had a hysterectomy at the age of 49 years old. She is currently using vaginal estrogen, which has helped with the vaginal dryness and pain with intercourse, but is wondering if adding over-the-counter progesterone cream could benefit her and how to find the product discussed on a previous episode. So this applies to our last question, actually. Adding progesterone can help with symptoms that are happening in spite of taking estrogen, either orally or topically or vaginally. Progesterone is our great balancer to estrogen. And so you could benefit from having progesterone cream. Progesterone is our sleep-promoting hormone. It's our mood-stabilizing hormone. And so it does, again, balance estrogen. It does opposite activities to the breast tissue than the estrogen does. So it is a great balancing hormone. And so you could try the progesterone cream and see how you do with that. And that would be dosed every day. Probably you're dosing your vaginal estrogen twice a week. Some people do it 3 times a week, but it's typically not every day. And so the progesterone cream would be every day. And in terms of where to find that information, I have another question from Casey who asked, where do I find the list of lotions and products y'all talk about in the 2018 episodes? So if you go to sweatyandpissed.com, now this is for both Casey and Harriet and anyone else if they want to know where the product information is. If you go to sweatyandpissed.com and go to the bottom of the page to the blog section, you'll see photos there with the titles of the blog. And you scroll through to over-the-counter supplements and go to the hormone support section and click on progesterone cream. It will take you directly to the link to the product's website. Those are the directions to get to the progesterone, of course. And then the other supplements will be in that over-the-counter supplement blog, and every name that's on there, every supplement name, you just click on the name and it will take you to a website with a product that I have recommended. Also, in terms of the lotions and creams and makeups and stuff like that, there are blogs that are about taking care of the mature skin. So you can find all those skin products in those blogs. Again, that's at our website, sweatyandpissed.com, at the bottom of the page where all the blogs are listed. You can scroll through them and get all kinds of information about the shows. I'm going to take a little break right now, and I will be right back, and I will answer a couple more questions for you. If you want a perfect fitting bra, then you need to listen up. Third Love uses the measurements of millions of women to design bras with all-day comfort and support that range in cup sizes from AA to I, including half cups, and band sizes from 30 to 48. Every Third Love bra is made with memory foam cups, no slip straps, and a scratch-free band. Yes, these are great bras, but the really amazing thing that Third Love gives you is a fitting room quiz. I think most women have difficulty choosing the bra that truly fits them because we're not often exactly sure how it should fit. Their quiz is super easy and fun, and it focuses on size, breast shape, current fit issues, and your personal style. By completing this quiz, Third Love can give you the bra and underwear that are perfect for you. While you're taking the quiz, there are fit stylists available to answer any questions that might come up. Between the quiz and the expert stylists, you never have to leave your home to find your perfect bra. You deserve a bra that is not only comfortable but high in quality, and if you don't love it, exchanges and returns are free. For me, the thing that seals the deal is the fact that Third Love is committed to giving back. They donate all of their gently used returned bras to women in need, supporting charities in their local San Francisco Bay Area and across the United States. So far, Third Love has donated over $40 million worth of bras. Third Love knows your one true fit is out there. So right now, they are offering my listeners 20% off your first order. Go to thirdlove.com/sweaty now to find your perfect fitting bra and get 20% off your first purchase. That's thirdlove.com/sweaty for 20% off today. Do it, ladies. Sweaty and Pissed listeners, if you are not loving your hair or your hair products, I have the perfect solution for you. Function of Beauty. Function of Beauty gives you customizable hair care by offering you precise formulations for your hair's specific needs. And it's so easy to get the perfect formula for your hair. It starts by taking a thorough quiz, during which you will give them info on your hair type and your hair goals. Do you want your hair to have more volume, look shinier, feel smoother, or is your hair curly, straight, thin, frizzy? Function of Beauty can help you. Next, you choose the color or fragrance of your hair products, or opt for fragrance and dye-free formulas. Then the team at Function of Beauty determines the perfect blend of ingredients, bottles your formula, and delivers it to you along with all the instructions you need. Every ingredient Function of Beauty uses is vegan and cruelty-free, and they never use sulfates or parabens. I love also that they will never use petrolatum. You can also go completely silicone-free if you want to. And Function of Beauty offers completely personalized formulas for body and skincare as well, so you can customize your beauty routine from head to toe. Never buy off the shelf just to be disappointed ever again. Go to functionofbeauty.com/sweaty to take your quiz and save 20% on your first order. That applies to their full range of customized hair, skin, and body products. Go to functionofbeauty.com/sweaty to let them know you heard about it from our show and to get 20% off your order. Since we are often talking about supplements on this podcast, I would like to tell you about Care Of. Care Of is a wellness brand that makes it easy to maintain your health goals with a customized vitamin plan that helps you feel your best today and supports you long term. I love that all of Care Of products are formulated with clean ingredients that are backed by science, and they will always tell you about the research and sourcing behind each of their products. In addition, the recommended supplements come in daily, individually wrapped packets. That is a very important feature because it will help you get into and maintain a daily routine of taking your supplements. I frequently tell patients that it is important to take supplements that are specific to their needs rather than grabbing supplements off the shelf that they hope will help them. Care Of's in-depth 5-minute online quiz asks you questions about your diet, lifestyle, and health concerns to help address your specific wellness goals. Taking this quiz is like getting a one-on-one consultation with a nutritionist, all without leaving your house. Listen up, all you female sweaty and pissed listeners. As moms, partners, business owners, women have a lot on their plate. Small routines like drinking a glass of water, taking your vitamins, or adding collagen to your morning coffee can go a long way in helping you prioritize your health and self-care. Why not celebrate Women's History Month by caring for yourself, by taking the Care Of quiz, and start a daily routine of supplements that are customized for your needs. For 50% off your first Care Of order, go to takecareof.com and enter code SWEATY50. 50% off. That's a 5 and an O. 50% off. So for 50% off your first Care Of order, go to takecareof.com and enter code SWEATY50. Welcome back, everyone. My next question is from Amina, and she says, I'd like more info about palpitations, please. How can I know if it's due to perimenopause or a heart condition? It scares me sometimes. Please advise. Thanks. Okay, Amina, I do need to do an entire podcast on palpitations during menopause and perimenopause. When our estrogen levels start dropping, we can definitely get heart symptoms, including palpitations, feeling like your heart is racing, feeling like you have a flutter in your chest sometimes. So definitely that needs to be worked up. So the first step is to make sure there isn't something going on with the heart that needs to get fixed. So that workup can be started with your primary care provider. They can do an EKG and maybe order a stress test or an echocardiogram, which is an ultrasound of the heart. Oftentimes we'll also order a Halter monitor or an event monitor. A Halter monitor is where they measure your rhythms for a 24-hour period. You wear a little monitor and they look at the rhythm for 24 hours straight. The event monitor you can wear for up to 30 days, and you press a little button every time you have the symptom. And oftentimes women will go through this workup and everything's normal, and the cardiologist will say, or the primary care provider will say, your heart is normal. I think it's your hormones. Hopefully they will say that they think it's your hormones, so you know maybe what the next step is. So once any kind of heart pathology has been ruled out, then we need to start looking at hormones and what needs to be replaced, typically in perimenopause, before you've stopped having your periods, or if you still have your ovaries and typically are in your 40s oftentimes. Progesterone often is the key to helping with those symptoms. So it is scary. I understand that. And that's why it just needs to be worked up. And it's not a difficult workup to figure out what's going on. And then when everything looks A-okay with your heart, then addressing your hormone imbalances can really, really help the symptoms. So I urge you to, and anyone who's having rhythm symptoms, they feel like their heart's racing or fluttering or skipping or thumping, you need to bring that up to your primary care, make an appointment, bring that up to your primary care provider and get that worked up. And then we can move on to hormones after that. But it's a really good question. And I do need to do a whole podcast on that so we can talk about all the mechanisms that are happening when people have those symptoms. The next question is from Maureen, who asks, what are your thoughts about taking low-dose Effexor for night sweats? My gyno suggested this. Okay, first of all, Effexor, which is venlafaxine, that's the generic name. Effexor or venlafaxine is what we call an SNRI, serotonin norepinephrine reuptake inhibitor, SNRI. So it is an antidepressant, but we have found that particularly in low doses, that it can help with what we call the vasomotor symptoms that women can get in menopause, like hot flashes and night sweats especially. Interestingly, at higher doses, some people get hot flashes and night sweats when they take Effexor. So it's sort of interesting that a low dose can help with those vasomotor symptoms. So that can help, and we often use an SSRI, selective serotonin reuptake inhibitor called Paxil or paroxetine in a very low dose, and that can also help vasomotor symptoms. And both of those are good choices if you do not want to take hormones to help with your vasomotor symptoms, or if you're not able to take hormones due to some other problems you've had, like breast cancer. So there are just some women who are not able to or shouldn't take hormones. And for those people, especially, an SNRI or an SSRI can be very helpful with those vasomotor symptoms. And typically when we don't have our estrogen, we can have some pretty significant mood swings, irritability, tearfulness, anxiety. So those medications can help with those symptoms as well. Thank you so much, Maureen, for that question. We have another little breaky poo, and I will be back shortly to answer a couple more questions for you. Okay, listeners, I have to talk to you again about Green Chef, which is the first USDA certified organic meal kit company. You can enjoy clean ingredients that are in season so that they are at their peak of freshness. If you want to make a great meal and save time doing it, Green Chef meal kits are pre-measured, perfectly portioned, and mostly prepped. They have so many wonderful recipes, and you are sure to find a plan that works for you because they offer keto, paleo, vegan, and vegetarian meal kits. Okay, my dinner tonight, this very night, was Green Chef's pork banh mi bowl. It was a bowl, not a sandwich, but a bowl. If you're not familiar with banh mi, it is a Vietnamese sandwich, but this recipe is the same yumminess without the bread. It was a colorful mixture of diced pork, broccoli, kale, roasted red pepper. That always sounds good, roasted red pepper, radishes, carrots, and cashews, all topped with a spicy ginger lime aioli. Does that not sound good? I think I hit all the food groups in one meal in that recipe. It was so good and super easy to prepare. This recipe contains pork, but if you're not a meat eater, you don't have to worry that you will not get the nutrients you need from Green Chef's vegan and vegetarian meals because their recipes are high in plant proteins and rich in omega-3s. I urge you to go to greenchef.com/90sweaty and use code 90sweaty to get $90 off, including free shipping. Go to greenchef.com/90sweaty and use code 90sweaty to get $90 off, including free shipping. Green Chef. It is the #1 meal kit for eating well. We're back, and I have a question from Robin, and she says, love your podcast. Wanted to see if there was a supplement you recommend after gallbladder removal. So there are a couple of things I don't know about Robin from this question. I'm assuming she's had her gallbladder removed, and what I don't know is what kind of problems she's having, if any. Following a cholecystectomy or removal of the gallbladder, we will have what we call post-cholecystectomy diarrhea. So we have diarrhea, oftentimes urgent diarrhea, after a meal because your gallbladder is just a little sac and it holds the bile that is needed to help break down fats when you eat. So when you eat, the pancreas sends out a little hormone message to your gallbladder and says, squeeze, so that you'll squeeze out some bile, which will help break down the fat in the food that you've eaten. So when we have our gallbladder taken out, we've taken out the little sac, our little storage pouch. So the bile isn't regulated anymore by the pancreas from a signal from the stomach that there's food in it. So when that happens, you just have bile constantly dripping down into the small intestine. So sometimes more bile is present than you really need based on what you've eaten. So we will end up with this urgent diarrhea. And so one of the things that I prescribe for my patients is something called Well-Call, or Cholecystectomy. Both of these are what we call bile acid sequestrants. So they are not a systemic medicine. When you take the medicine, you take the pill, you don't absorb it. What it does is act like a little sponge, and it soaks up extra bile. So if someone takes that pill before they eat a meal, a fat-containing meal, then any extra bile can be sucked up by that little pill. And actually, it's a big pill, but we won't go there. Anyway, it's sucked up by that pill so that we don't have so much bile that we end up with this urgent diarrhea. So it can be extremely useful. We use those medications actually to lower cholesterol, but we use large doses, like Welchol. We use 6 tablets a day, but you don't necessarily have to have that many. Sometimes most people just take 1 tab before a meal, again, a fat-containing meal, and it will suck up the extra bile and prevent that urgent diarrhea. It's a very, very useful tool. So if you are having, Robin, post-cholecystectomy diarrhea, you need to, again, see your primary care provider and ask him or her if you could have something like Welchol or Cholecystectomy, a bile acid sequestrant, to help you control your post-meal urgent diarrhea. Our last question comes from Alicia, and she's actually asking a question about her 18-year-old daughter who suffers from anxiety and depression. And it's pretty common, unfortunately, at that age. We see a lot of anxiety amongst teenagers, and I'm glad that she has you to help her get help. So she was started on meds and L-methylfolate, but is a little better, but not as much as they'd hoped. Alicia wants to know what I recommend for ideal thyroid lab ranges, because apparently she had her thyroid levels checked. I don't know exactly what lab she had done, but had the thyroid checked and was told that they were normal. So I do want to just say briefly a bit about L-methylfolate for those who haven't heard the podcast about MTHFR. There is a genetic variant called MTHFR. And when you have that genetic variant in your DNA, it prevents you from methylating, or basically metabolizing, folic acid or folate into the form of L-methylfolate. And L-methylfolate is our usable form of folate, which is a B vitamin. And so when we have that a variant, MTHFR, and we're not converting or methylizing our folate into a usable form, we can have more anxiety, depression, ADD, peripheral neuropathy, because B vitamins are so important for our neurologic health. So in someone who has MTHFR genetic variant and has depression or anxiety or ADD or peripheral neuropathy, it is advisable to start L-methylfolate, and we usually do it in fairly high doses. So that is definitely something that needs to be managed by a medical professional, but it can be very helpful in treating depression and anxiety in those with that genetic variant. So in terms of the thyroid labs, and it's the reason that thyroid labs are typically checked is that when we have especially low thyroid, we can have depression as one of our low thyroid symptoms. So typically, that is something that gets checked to make sure it's not just an underlying thyroid problem that is contributing to the anxiety and depression. So in Alicia's comments, she stated that she knows that there are different ranges that are recommended in terms of blood levels for thyroid hormones and TSH. What she is referring to is the difference between optimal ranges and what we call normal ranges. So the blood work that you typically get at your physical, or if you go in with a problem to your provider, are that we're looking for normal ranges. And that's a pretty wide range on most tests that we do on the blood. And it's wide because we're really looking for pathology. We're looking for something that's way beyond what could be normal. And again, optimal ranges are looking for numbers where you are at your healthiest. For example, a TSH, which is thyroid stimulating hormone that comes from your pituitary gland, and it sends a message to your thyroid gland to secrete more thyroid hormone. So a TSH at some labs might be, normal range might be 0.3 to 5.0. And an optimal range would look more like 1.8 to 3. So in that case, somewhere in the middle of what the optimal range is, somewhat in the middle of the normal range. When looking at free T4, which is the hormone that is secreted from your thyroid gland, a normal range may be 0.6 to 1.2, but an optimal range might be 1.0 to 1.5. So usually on the upper end of the normal range with the thyroid hormone levels. So it's a little bit different way of interpreting the labs that you have drawn. And the providers who look at optimal levels are usually someone practicing what we call functional medicine. And so their goal is really much more health-oriented, maintaining your health versus finding illness. I don't know what labs your daughter had drawn, Alicia, but oftentimes it's just a TSH and sometimes a free T4. I often draw also a free T3, and I also check for thyroid antibodies, specifically thyroid peroxidase antibodies and thyroid globulin antibodies. And some providers will also do a reverse T3. Sometimes that can be helpful piece of information. So there are different thyroid labs that aren't always drawn certainly at a routine physical. A TSH would be the most common thing to have drawn at a routine physical. But again, certainly a functional medicine provider would be more likely to draw a more comprehensive thyroid panel. I wish you and your daughter well, and I applaud you for working hard to seek help for your daughter. Many thanks to Green Chef, Function of Beauty, and Third Love, our sponsors for today's episode. I also want to thank Forrest Wenzel for producing and for our theme music, and Stephen Brown of Glitterville for our artwork. Remember that our podcast will be continuing, but the name will be changing to Itchy and Bitchy. Stay safe, be well, and thanks for listening.
Sweaty and